To the anesthesia training series. I'm Charlotte Marquis. I'm a board certified veterinary anesthesiologist, and today I'll be talking to you about anesthesia for brachycephalic pets. So I'm a little bit biased. I really like these guys. They're very cute. They're not going away anytime soon, and they are incredibly popular with both our veterinary staff and our clients. And they're not exactly simple to deal with or to treat. And they do have some really important differences amongst them that can make them a little bit difficult to work with and to keep healthy. So I just want to give you a couple of pro tips for how to handle and how I approach brachycephalic pets when it comes to anesthesia. So I guess the first thing is to talk about what is a brachycephalic pet and what are some examples of this. So when I think of different breeds of brachycephalic pets, I think both of cats and dogs, because it's not just dogs, right? There are definitely some short-faced brachycephalic cats. So I think about dogs like pugs, French and English bulldogs, definitely some of the most popular. Also your tiny dogs like Brussels Griffon or like a Shih Tzu, things that have like really big kind of globular heads. And then things like Persians and Himalayan cats. So important to remember that these guys kind of count for that too. They have a shortened face, which also can make things a little difficult for them. So think about both dogs and cats here. So brachycephalic, meaning short head or short face. They do have a couple of anatomic differences which are very, very relevant to anesthetic and sedation practices. So you need to be aware of these. So lag ophthalmos and decreased corneal sensitivity. So lag ophthalmos, that means hair eye. So what this means is that the animal has kind of like a very wide open kind of globular eye. So there's not a lot of coverage by the eyelids. And this is in part because the animal has like more soft tissue, but not necessarily a lot of skull support for the eyeball. So they're very likely to have things like dry eye, decreased sensation of the eyeball, and that kind of matched with the fact that they have like a big, very open eye, they're very at risk for developing corneal ulcers. And you guys probably know when animals are sedated and anesthetized, they don't tear as much, so the eyeball is much less protected. We need to keep a really good eye on this, pun intended, ourselves. Short maxilla to mandibular ratio. So these guys usually have a short top part of the face and a longer bottom part of the face or the mandible. And because of this can make securing the endotracheal tube to the animal's maxilla almost impossible. So usually you have to use the bottom or you have to use the back of the head. Another thing that's going to lead to is dental malocclusion. While this may not pertain exactly to your anesthetic or sedation plan, if you're securing a tube, a lot of people will put it behind the canine teeth. But if you have like a brachycephalic English or French bulldog and it has a bunch of missing or misplaced teeth, that's going to be a little bit difficult for you. So think about those things in those types of pets. Now I want to talk about some of the airway and facial abnormalities which can directly impact your intubation plans. So stenotic nares, everted laryngeal saccules, elongated soft palate, hypoplastic trachea, and then things like orthopedic abnormalities. So when I think about these things, it's usually smaller and not enough. So stenotic nares, it means instead of having a nice open nose, these animals usually have kind of a very, very small place where air can enter in and out. This is obviously challenging because if you have an animal with an airway problem and the nose doesn't also work so well, that's kind of an issue. Everted laryngeal saccules, so this is something you might see on intubation, might make it difficult to pass your endotracheal tube or difficult to kind of identify normal landmarks. Elongated soft palate, so thankfully when you intubate, the palate itself is not a problem because you're going to protect the airway with the endotracheal tube, but certainly the palate can be entrapped inside the airway, and that can make visualization very difficult. Hypoplastic trachea, so this means smaller than normal. So not only is the trachea smaller, like it does take a smaller size tube compared to the size of the dog, the opening itself is usually a lot smaller. So I always think about downsizing airway equipment in these species, very important. And orthopedic abnormalities. So when I'm talking about this, I usually mean that they usually have some type of limb deformity. So things like hip dysplasia, cruciate ligament disease, very common, especially in overweight brachycephalic dogs, that is. Usually kind of wide, bandy legs that are shaped like a triangle. Sometimes they have carpal valgus. So sometimes identifying normal vessels or placing IV catheters in these dogs can be really difficult, not only because they don't like being restrained because of their orthopedic diseases, but also because it's just hard to tell where the vessel goes, right? If the leg is not shaped normally. So these are all things which I think make anesthesia difficult for me because it's hard to identify what's normal in these dogs. And that's their normal, right? So usually anatomy leads to physiology, right? So these things have a direct impact on how the animal works. And I'll tell you a couple examples of why. So physiology, brachycephalic dogs are less sensitive to carbon dioxide. So why is this important? So because brachycephalic dogs have chronically high carbon dioxide, so that's called hypoventilation when the CO2 is elevated, right? Because they chronically hypoventilate as a result of the way that they are built, their brains are less sensitive to it. And that is a problem because CO2 provides 80% of an animal's drive to breathe, same as in humans. So what this means is that when the CO2 gets higher, especially when they're sedated and anesthetized, because those drugs will also impact CO2, the animal is less likely to initiate an appropriate response to that. Usually if your CO2 goes up, you're going to breathe faster and deeper to help get rid of it. And remember that CO2, not only does that help with breathing, but CO2 has an effect on blood vessels. So the higher your CO2, the more dilated blood vessels get. The more dilated, sometimes the worse the blood pressure. So it is really important to have normal CO2 balance. And unfortunately, these animals don't have an appropriate response to that most of the time. Increased likelihood of sliding hiatal hernia, prolonged esophageal transit time, and esophageal motility disorders. So these guys, especially French and English bulldogs, have a higher likelihood of having motility disorders in their esophagus. So food and saliva does not move as quickly or as normally as it should. And this is problematic because if you have an animal that was even if it was appropriately fasted, they can still have the chance to regurgitate and then aspirate, which can lead to a low pulse ox, pneumonia, morbidity, and mortality. Such a bummer. So those are the things I think about when I think about risks for brachycephalic dogs and cats. Implications. So what do these things mean together and how do they directly impact your anesthetic or sedation plan? So the airway abnormalities here, especially hypoplastic trachea, elongated soft palate, that's going to make your intubation challenging. So I would anticipate using a smaller endotracheal tube. I would anticipate having a difficult time seeing what's going on back there, maybe having trouble identifying a normal landmark. Challenging vascular access. So lots of brachycephalic dogs, English and French bulldogs, they have really tough skin. They have kind of weird misshapen legs. So it can be difficult to identify a normal vessel. And even then, the animal might not be cooperative for catheter placement. So I think those things are very hard for me. I have a feeling it might be difficult for you as well. Increased likelihood of needing supplemental breaths or mechanical ventilation. So, if you have a dog that's not as sensitive to its own CO2 and the CO2 rises beyond normal, you might need to give that animal supplemental breaths or put them on a ventilator, just because they're less sensitive than a normal dog. Increased likelihood of regurgitation. So these dogs, if they have sliding hiatal hernia or motility disorders, you should anticipate that, and you should also think about medications or techniques you can use to maybe prevent that. Endotracheal tube is going to be smaller. So, a 20 kilo hound or mixed breed dog, you're probably thinking 9.5, size 10 endotracheal tube. But if you have any of these, a 20 kilo English bulldog, that's going to be anywhere from a 4.5 to a 7. They're going to be much smaller. I would not usually put a tube that's any bigger than that. I think that would be very unusual. So anticipate they're going to be smaller and make sure that you get a range of different tubes, because sometimes you're going to try one, it's just not going to work. So with those things in mind, you know, we have all the scary stuff. What are some things we can do to help us get prepared and help us be like ready to deal with this on the clinic floor? Don't be afraid of sedation. So I think a lot of people are very wary about giving sedatives to brachycephalic pets because they're worried that the animal is going to vomit, regurgitate, maybe have an airway obstruction. But what I also want to tell you is that airway obstruction and fear, anxiety, distress can result from inappropriate handling or from an animal that just is not cooperative. So if you have a very wiggly French bulldog, if you have an animal that you know is not going to tolerate a catheter, just sedate them. It is much better to have an animal that's cooperative in getting oxygen in an IV catheter than an animal is stressed and you try to just muddle your way through it. You can achieve this through a variety of different mechanisms. You can use oral sedatives like gabapentin and trazodone. Using the chill protocol is an excellent idea for these animals. And then you can use injectables. You can do this IV, you can do this IM. So alpha-2 agonists, acepromazine, phenothiazines, these are fantastic options for these animals. I would be cautious with giving full mu agonists IM. So it is helpful to use sedatives, but I want you to be careful about using things like hydromorphine and buprenorphine IM. So this is just a personal preference. Me personally, I do not give full mu agonists to brachycephalic dogs IM. The reason why I don't do this is because I know they're much more likely to regurgitate and usually vomit when they get IM premedication. If I do have an aggressive or an uncooperative French or English bulldog, then I would rather use something like methadone. Yes, it's a full mu, but there's no histamine release. They almost never vomit. Alternatively, if you don't have methadone at your clinic, I would use butorphanol. And then an hour later, if your animal's getting painful surgery, just place a catheter when they're ready and give an IV full mu an hour later. That's how I come around those things. Now again, you certainly can do that if that is what your practice is doing. If it's working for you, that's great, but I just wanted you to have that information so you know how I approach those on the clinic floor. Think about other medications, prokinetics, antiemetics, and antacids. So if you know these animals are more likely to vomit and regurgitate, maybe think of techniques and medications you can do to limit this. So limit the acidity of the stomach fluid by giving histamine blockers. Limit the likelihood of vomiting by giving antiemetics like Cerenia or ondansetron. Limit the likelihood that a motility problem will cause the animal to be irpy or regurgitate. Think about prokinetics. So when I think about these dogs, I usually give antiemetics, for example, Cerenia or Mirapatin, at least 1 hour prior to anesthetic induction or when I'm going to give a full mu, because the studies tell us that if you do that, they will prevent vomiting pretty much 100% of the time. That's pretty good. So I want to do that if I have any choice at all. There's a variety of different drugs you can use. If Cerenia is very expensive for your clinic, do not feel you have to use this. You have other options. Happy to talk to you about that. For these dogs and cats, do not be afraid to intubate or convert to general anesthesia. So lots of problems happen in brachycephalic dogs as a result of airway compromise, regurgitation, an uncooperative dog. If your animal is not tolerating the procedure well, if you think at any reason they're struggling to move air, just intubate them. It's just going to be so much easier to manage them, and that way you can protect the patient, and in effect, you're going to protect yourself from legal problems. Lastly, the thing I want to talk about is, we talked about how vascular access can be challenging in these dogs and not to be afraid of sedation. Consider some things that might help you place the IV catheter. So not only does this mean grabbing the most experienced hospitalist you can if you're really struggling, but things I like to do other than IM sedation would be using things like tourniquets. So if you have an animal with a wide bandy leg, it can be very difficult to hold off the vessel. The tourniquet makes that so much easier. Long IV catheters. So most of the time we like short IV catheters because it's easier to get the medication in, less resistance, right? According to Poiseuille's law. But if you have a long catheter, it's much less likely to be pulled out by the dog. And I think especially for these guys where their legs are weird shapes, it is super helpful to be able to have that. What else? A needle nick or a cut down. So lots of these bulldogs have thick skin. If you can see the vessel, but you feel like you can't feed the catheter, doing a little nick with a 20 or an 18 gauge needle can be so nice in just helping that pass through the skin. And actually, although you have to nick them, I feel like that reduces the trauma of just like trying to get through the vessel with the catheter and the stylet. Again, sedation is your friend. Like if you don't want to give injectables, think about oral medication. That's just going to be so much easier. Lastly, if you're having trouble finding a vessel other than grabbing a buddy or an experienced hospitalist, think about using ultrasound. So you're not just limited to vessels in the legs, right? We have vessels on the upper inside of the leg. We have, the jugulars. We can always do something like a PICC line or a central line for animals that are particularly difficult. So just think about all your options, and that way you're going to be prepared for all of those things. The last thing I'll say when it comes to some of my pro tips along with intubation, we talked about smaller tubes. I do something called a rapid sequence induction in all of my brachycephalic pets. So what this means is shooting premedication and induction drug right away and keeping the head up until you can intubate the dog. This allows you to secure the airway faster and therefore protect it from things like regurgitation and saliva. In a traditional induction, you would give medication, give oxygen, wait 3 to 5 minutes, and then intubate. But for these guys, I want your goal to be to get them intubated within about a minute. So the next time you have one, think about trying that and just maybe try some different ways that we can think about protecting these dogs and cats. And that's it.